Now the nipples are inside.
They are inside. They are inverted.
And then they are cracked. You should be worried about it. Or you've noticed that you know how the skin of orange looks like.
Yeah, the dimpling.
You notice that dimpling around, or you notice that there's dark coloration around your breast. You shouldn't sit and go like, oh, it's nothing. The slightest change you see, it could point to something. So then you should also be proactive and then go to the clinic to go and check out the hospital. That's why we are saying that it starts from you.
From Kerry Washington's perspective, you cannot really take care of the people in your life if you do not take care of yourself. I am guilty. I'm guilty of not taking care of myself. All my life, I have never gone for a breast cancer screen because I think I am okay and I'm afraid of the results if they come out positive. I've engaged a couple of women and they have expressed that the reason why they find it difficult to screen is that they find the process too intimate. And now another woman also expressed that a male nurse that examined her friend called her in order to begin a sexual affair. Well, we are in October, the Breast Cancer Awareness Month, and we entreat all of us to take care of ourselves. And on speaking with that, Bob Freeman Clinic, located opposite the Embassy of Lebanon, Osu, is doing a free breast cancer screening this October. So if you have not come from October 1st till now, this is the opportunity. I think I have to go as well. It's high time I go and check myself. Men are also not excluded from this list because 0.5% to 1% of men, according to the WHO statistics, are vulnerable at risk of being diagnosed with breast cancer. And in the effort to make this October memorable, we have Dr. Tete Fio and Nurse Endurance Tete, who will help us better understand our breast, the disease, treatment, therapy, and management. Welcome to the Covered Conversation. My name is Akbene Ama Asigbe, and I'd love you to join us on YouTube at SIC Insurance PLC. Welcome, Ness. Welcome, Doctor.
Thank you, Amma.
I'm happy you're here with me.
I'm happy to meet you.
Yeah, I'm happy I've made time. Okay, so let's dive into this. What is this year's theme for breast cancer? Any of us could do the introduction.
So before we even go to the theme, let's just give a little story about breast cancer.
Sure.
So basically, when we say cancer in medicine, it's an abnormal growth of cells. So the beautiful thing about medicine is that the site of the infection, or where the issue is where the name of the cancer is derived. So when we say breast cancer, it's basically abnormal breast cells in your breast. Okay. So just for people to get a clear idea about it, and then I'll leave Endurance to talk about the theme for this year.
Great.
Okay. So this year, our theme is every story is unique, every journey is different.
Okay, every story is unique. Every journey is different. Okay, I think that should sink in for a moment. That's true. That's very true. Thank you so much. So, Nurse Endurance and Dr. Tete Fio, and kindly help me. Why would you suggest that women go in for early diagnosis and regular screening? Why is it so important?
So, the thing about cancers is that when you catch it early, you can treat it early and then you can survive it. And there's the essence of early detection, which always saves lives. Basically, with breast cancer awareness, what we are trying to do is that we want to detect the cancer early, or the lump early, so we can go in and institute the right treatment, and then the patient can survive. Because one thing is that, unfortunately for us in Ghana, most of the patients who report to us report with advanced stage. 70% of women actually do that, and every year we have like 4,500 of women who are diagnosed with breast cancer coming in at a very late stage. Most of them may have tried the orthodox therapies and they don't work. So by the time they come, they either come with disseminated infection, like the cancer has spread to other parts of the body.
That's spread.
and they're coming with foul smelling ulcer on the breast, you get it. But if these women had seen the lump early, if they had seen it early, so it means if they caught it early, it was treated right, then they would survive it, and they don't become a burden to themselves, they don't become a burden to their family, because cancer treatment has a huge cost and financial burden.
And one thing I've observed, even for myself and the engagement with women, is that I don't go because I feel I'm fine and I feel like I'm okay, and I'm afraid of what even the personal screening may okay, when I feel perhaps a lump under my arm or something. How can we deal with that? At least you're in the health business. How can we deal with the fear and do something personal and even further go to the health center, the clinic, the hospital? Endurance, please help us.
Okay, so that is why we are creating the awareness. So as part of our awareness creation, we explain why the individual has to be proactive in his or her own health. Yes, and also have knowledge about the breast. So whilst we create the awareness, we make you understand all these things, the dangers of detecting the disease late. So when the people get to understand this, then the fear goes off. Yes.
So that means that awareness is a thing. Yeah. So do you think that it shouldn't just be October? Because according to the Dr. Tetefio, women 70% wait until it gets to that very critical stage before they run to the health center. So do we advise as health personnel that it shouldn't just be October? From 1st January to 31st December, the free screening should go on, or even if you pay something, should be something little. Is this something you would suggest?
It's something we do every time. In our work, yes.
Okay.
Because most people come around, even though it's not October, they ask you. Some even come and they're like, I've seen this on my breast. Can you please take me to the examination room
and
look
check?
At it? Yes. So we use the opportunity to educate them. Yes. So we don't wait for October alone, but anytime that we meet those cases, we
so Dr. Tetefio, so I think the problem is that the 1 people that are coming are still the 1 people who come. So now it's like about the mass, the masses,
the mass population.
Yes.
So with them, that's what you see when it comes to breast cancer screening. It's not just in their facilities. We have the self-breast exam, which starts from you, and like Endurance says, that one is your personal responsibility. It's a service you owe to yourself. So it's you as a woman, especially men too can check, because there's a 1% possibility of them getting breast cancer.
Yes.
But as a woman, right a week after your menses, you are supposed to personally examine your breast. Now, the beautiful thing about you, a woman, personally examining your breast is that as you examine it, your fingertips is where we usually use to do the examination. The more you do it, the more you get to know how your breast feels after your menses. And so you can detect whenever there's a lump or anything abnormal happening in your breast. Then you can go in to seek early treatment. Now, when it comes to breast cancer, it's not just the lump that shows that. It's not, the lump shouldn't be the only thing you look out for before you go to the hospital or the clinic. Generally, by God's design, our bodies are not exactly the same when it comes to the shape and the sizes. There's one that's slightly bigger than the other, and it's normal. There's nothing to worry about. But when you as a woman, you realize that one breast is sagging and the other one is getting closer to your chest, then you should be worried. You realize that your skin around on your breast is folding together. We call it skin puckering. Then you should be worried. You're a woman whose nipples are inverted, they're out, they're pointing like Bobby stand.
Yeah.
And all of a sudden,
don't be shy to say that. Bobby stand, please.
Then all of a sudden you realize that now the nipples are inside.
They are inside. They're inverted.
And then they are cracked. You should be worried about it. Or you've noticed that you know how the skin of orange looks like.
Yeah, the dimpling.
You notice that dimpling around, or you notice that there's dark coloration around your breast. You shouldn't sit and go like, oh, it's nothing. The slightest change you see, it could point to something. So then you should also be proactive and then go to the clinic to go and check out the hospital. That's why we are saying that it starts from you. you check it for yourself. Then as you constantly check it, you know how your breast feels, and then you can go in, and then if there's a need for further tests, either a breast scan depending on your age or in your family history, or a mammogram, then it can be done. But the caveat here is that you, as a woman, you always check it a week after your menses. Reason being that during your menses, after ovulation and before your menses, your breast is a little bit tender and painful.
Yeah,
so when you do it during that time, it can be a bit more painful, and then it feels also lumpy. So you may not be able to get a good result when you do it before a week after your menses. So what we advise is that you do it a week after your menses, and then you're good to go.
Okay, so nurse endurance, what about the men? Because they have a 0.5% to 1%, according to the World Health Organization, they are susceptible to breast cancer. What do you say about that? I think they feel exempted.
Yes, so this time, formerly we used to say that because it doesn't affect men most, they relax. But this time, the advocacy is that they should also take interest, because our men are being diagnosed. And once a little percentage is being diagnosed, you may not know, maybe you may be the next man to get it. So they should get involved. And then, in fact, this time we're even happy, and we were praising the gentlemen who were wearing
the pink shirts.
Yes.
Okay.
So we really appreciate them for their support.
There's this myth I hear that men who are plus size are more susceptible to breast cancer. How true is that?
So, there are risk factors to getting breast cancer. Like I said, genetics is one factor. Your family history plays a role. And then your personal lifestyle, your weight, alcohol intake, level of physical activity. So plus size, what it does is that the hormone that actually stimulates and causes breast cancer, which is estrogen, are more abundant in women than men. That's why women get breast cancer more often than men, would be in excess quantity, and then it gives the chance for cancer to be formed. So plus size men, yes, I haven't heard a lot of studies regarding them getting it, but when a woman is a plus size woman comes to the clinic, one of the things we advise them is to lose weight, because weight loss helps with your health and your overall health at the end of the day.
Okay. So this is Covered Conversations. We are talking about breast cancer. We are in October, the Breast Cancer Awareness Month. Kindly join Covered Conversations on YouTube at SIC Insurance PLC. I'm very concerned about the men. What about them? What are the things when they start seeing they should be concerned about?
We may not see like the classic symptoms in men like women, but obviously they could see the discharge. They can maybe notice the nipple eversion or retraction. They can notice the skin changes. They may not get the dimpling like a woman would because of the volume of breast tissues we have, but there will still be some dimpling that they may see, because that dimpling is because there's reduced drainage of certain substances back to the right place. So then there's buildup of that fluid there. So the dimpling would definitely show, but it wouldn't be obvious,
as visible as
exactly. So yes, and that's already mentioned that women should not only focus on our face in the mirror, but men too. When you get there, don't only focus on your beard. Examine yourself totally.
Thank you very much. Thank you very much.
Don't focus on your beard and your 1 or 6 pack. That's not the only thing you should be
before
seeing
the 6 pack. There's the breast.
Exactly. There's
so
the
check
breast.
the breast first.
The breast before there's an order. So from your beard, you come in through your breast. Make sure that everything is fine. Then you can see your 1 pack or your 6 pack or your 2 pack, whichever pack
or your
you
0
have.
pack.
Exactly, or your 0 pack.
Sure. Okay. So what are the treatment options that are available as far as breast cancer is concerned?
Welcome to SIC Insurance.
At SIC Insurance, we are always ready to come to your aid when the unfortunate happens. Call us today for your motor, accident, fire, burglary, travel insurances, and more. Or visit our website or any of our branches nationwide. SIC, our promises are sacred.
The treatment of breast cancer is not cast in stone. Treatment of any medical condition basically always depends on the time you report to the facility. So like that.
That's why we are preaching early
screen, diagnosis with the screening. You get it. So depending on the stage you report, it will tell the kind of management. If you come in and then we can do what we call a lumpectomy, so we take out just the lump. You are good. Maybe you just need that one, because the breast, when they are metastasizing, they go to, there are different points of the bodies they go to that they seed into, and then they can spread. So for the breast, it's always in the armpit. So if you check that area and then there's no evidence that it has gone to lodge in those areas, we could just do the lump, take out the lump out, which is called a lumpectomy, and you're good to go. If the whole breast tissue has been greatly affected to a point, we can take out the whole breast. Now, plastic surgery is doing beautiful.
That's nice.
So we can do breast reconstruction surgery for you, and it wouldn't be
You
like
have
that bad.
You have a bobby stand.
You know, you get a
Okay, okay, it's not that bad.
You get it. So
Okay.
we can do that for you. So you can do the lumpectomy. That's still with surgery. You can do
Okay.
the mastectomy. It's still a type of surgery, but then
Okay.
just trying to break it down further. Then you can do the hormone therapy, because breast cancer, there are different types. There's one that's hormone sensitive or hormone reactive, response to hormone treatment.
Okay.
And there are some that do not respond to hormone treatment. And
Okay.
unfortunately, that one is very aggressive. The one that doesn't respond to hormone treatment. And we've seen a lot of that in African women. We have young women under the age of 35 now being diagnosed with advanced stage of breast cancer, and they die in a matter of months. I've heard like 2, and I personally know 2 to 3 ladies who are younger than 35, diagnosed with breast cancer, and then they just died in no time. Yeah. So we have the surgery, like she mentioned, then chemotherapy, we have radiation therapy, we have the hormone therapy, and all these are various forms of breast cancer treatment. And if you report late in the advanced stage, then we have to do palliative care for you.
Yeah, where you'll be at home and you'll be taking care of.
What we basically do at that period is to make sure that we are alleviating the symptoms you are having. We're not going to really do anything extra. We are alleviating the symptoms to give you a better quality of life, so that you can die peacefully and with little stress. Yeah.
Does age play any important role in being at risk of being diagnosed of breast cancer?
The thing with age is that, so in the past, what they used to say was breast cancer was a disease of the elderly woman. So it was seen in women who are menopausal, because at that time, like we expect that from that time, that's when we start 40 years and above. But like I said earlier on, now we are seeing a different trend altogether, where we have women who are less than 40, even as low as 35, being diagnosed with aggressive form of breast cancer and then dying after a short period. So age plays a great factor. Age determines the kind of investigations we'll do for you when you come for screening. Because women who are less than 40, we do the breast scan, because they could also come with the breast lump, which is non-cancerous, very benign. We can just take it out and it doesn't do anything. Or above, and then those above 40, that's when we do the mammogram. And there also, I just want to chip this thing that if you have a positive family history of breast cancer, somebody who's ever had prostate cancer in your family, ovarian cancer especially, there's a need for you to start screening at a very, you don't wait till you're 40 before you start mammogram. You start mammogram by 35.
Okay.
So you see, all these things require you to come to the hospital, come to the clinic, for us to have an extensive discussion with you. Then we can know the right approach to take in tackling whatever you can.
So that means age really is an important influence.
Yeah.
Oh, okay.
Age does.
So how is let's say somebody is diagnosed of breast cancer, how does that affect their lifestyle?
It does affect a lot, because now your diet is going to, because there are some foods that when you take, it wouldn't help you in that state. I think you are made to see the dietitian to help you with the type of food that will be okay for your condition. So you'll be a little restricted in some areas. So that even gives some people emotional stress. Let me put it that way.
So emotionally become disturbed.
Yes, because now they can't eat everything. Let's put it that way.
Oh, okay.
And just to add to it, the mere thought of being diagnosed with cancer already scares someone.
Oh my God.
So we are looking at the psychological effects. We're looking at fear. We're looking at anxiety. We're looking at depression. Exactly. They are looking at emotionally how they feel. And the ones has mentioned which will also tie with the depression. Then their body image. Prior to breast reconstruction, most women will not want to do it because they want to keep both breasts intact and go to the grave with it. But hey, my dear, if it's not helping you, just take it out. There's breast reconstruction surgery now, and then you can do it. Then look at the financial burden. Cancer treatment can be so costly. And so look at that burden on the patient and then their family. And then even what it does to the entire family, this stability it can come with and all that.
Because
So,
when you lose a loved one,
and knowing that the person has cancer, I mean, it does a lot.
or even when the person is a breadwinner, and because of that, the person is in palliative care, as you say, palliative care.
Literally, you may end up spending all the resources in handling it, and it can be very devastating. Very devastating.
So sorry.
And the fact that some ladies also feel insecure, even when their breasts were there.
Yes.
They are still,
and some of us are not always proud of our breasts.
Take what God has given to you and appreciate it.
About their husbands being unfaithful. So when they lose their breast this time.
Even when it was there.
He was
going, now you fly.
Without looking back.
So they feel very insecure, and that alone breaks them down.
Women.
So they need a lot of psychological and emotional support around this time.
So so it will bring us to our last question. Not even the last question, because the last one is a demonstration. But this last question, so how can we as individuals, families, communities, organizations, churches, how can we help to actually let this thing drum into our minds that this is breast cancer, we shouldn't play with it, check your breast, go to the hospital? What can we do?
So it's all about awareness creation. Again, all of us have to put ourselves in. So as parents, we can start teaching our kids very early.
Yes, so both male and female.
Yeah. So when they go to school, they can also tell their friends.
Yes.
So it starts from home.
From home.
Yes. Very early.
Yeah.
So as we all put ourselves in, colleagues at work, we need to be telling each other. When we get the information, let's spread it. Because now breast cancer is becoming so rampant. At first, it was few cases. But now, if you take about, let me say 10 people, you have 7.
Hey!
Yeah, it's too, now it's too much.
What is it? What I'm interested. What's it? 7 out of 10? That's a lot.
That's a lot.
Why?
Diagnosis, time of reporting, all those play a role.
Okay. So the main thing, I think the focal point of this discussion is early detection.
Exactly.
Because when you come early, even if there's cancer, or even if it's benign will mean that it's not cancerous. Like at least you'll be aware of your status. Okay.
So we don't even have to wait for October.
No, you don't.
You don't have to wait for October. No. You don't have to wait for the whole world before you check your breast.
Exactly.
Okay.
Your health is your wealth, so you should be proactive about it and then handle things.
And it brings us to the quotes that I introduced, that you cannot take care of the people you say you love if you don't start from yourself.
No, you can't pour out of an empty cup.
You can't pour out of an empty cup.
Yeah.
Oh, okay. Doc, do you have anything to add?
Well, I think Endurance has literally said everything, but then we are using this opportunity to also call on our traditional leaders to join in the campaign to educate the population, the youth, the women, the men there, to personally be interested in screening themselves, checking their breasts for early signs of breast cancer. We are calling on media houses who also have the airtime to also make noise about breast cancer. We shouldn't wait for the world in October before we make noise about breast cancer, because it's claiming a lot of lives. And losing a loved one to breast cancer can be very devastating. So they should also we are calling on them to be advocates, and then advocates for early and personal screening of breast cancer, of early signs of breast cancer, so that we can step in early and then help to reduce the burden in the country. Yeah.
This has been covered conversations, and Dr. Tetefio and Nurse Endurance has really been opening our eyes. Please, it is time for Dr. Tetefio to show us how to do the screening ourselves.
Okay. I would have to get up.
Okay, so let's go. So just, okay, sure.
Okay, so imagine myself in front of my mirror.
Okay.
My top is obviously off.
Sure.
My bra is loose. So you're standing in front of your mirror and you're doing a no bra morning or afternoon or evening. And then you put your hands on your hip. You examine, you come forward slightly and then you look at both breasts just to be sure that they are the same size.
Okay.
You look at your nipples. How are they looking?
Okay.
You try, if your breast is, you have berries like Amma and I.
Okay.
You can safely look at it, look around it, and then you're fine. But if you have berries, as in your breast is small,
Like orange, apostrophe orange, small orange.
yeah, like oranges.
Yeah.
You can just look at it, lift it, and then you don't have to use a lot of force. But then some women have bigger breast tissue, so we call them melons.
Okay.
So she would have to lift it up more, look under the breast, look under the whole area, and then check if there are any skin changes there. Then you hold the nipple and then press it gently, like this,
Okay.
just to see if there'll be some discharge. Now, if you are breastfeeding, obviously we know there'll be some whitish milkish discharge. It's normal. At least so 2 years of breastfeeding is fine. But post 2 years after breastfeeding, if you're still seeing it, then we need to check what's going on. You should be concerned about it. But if you're seeing a bloody, greenish, yellowish discharge, you should quickly pass by for us to examine. Now you check your breast, everything is fine, there's no issue. You just place one hand, I can place one hand here like this, and then you divide your breast into 4 quadrants. 4. So 1. So you're doing it with the flats of your fingers.
Okay.
And when you place it there, you're trying to cover as much space because you divided
Yeah,
it
into 4.
using the nipple as the point of reference.
Okay.
So the nipple, let's say my nipple is here, here. So then I come here, I come here, then I come here, I come here.
Okay.
Now there's a tail of the breast here, so you always have to also examine this place and then just look.
That's the underarm.
So I'm not going into my arm,
Underarm.
but then just around the
underarm.
Try and feel underarm. Sorry, thank you. Just try and feel if there's anything funny there. So if you don't feel anything funny there, then you are good to go. So remember, you divide your breast into 4 using the nipple as the reference, and then the flats of your palm. You go in, dig in, you dig in, you dig in, you dig in, and then you dig in. Now, when you constantly do it, like I said earlier on, your nipples get a feel of how your breast is done. And you're doing this a week after your menses. So your nipples know, your fingers know how your breast feels.
Okay.
And then if the fingers detects any funny change around that period, quickly you can
sense it. Okay. So the funny thing will be like what, like a lump or something.
Feel a lump.
Okay.
Then that one we know we can go.
I can do it. Yeah. Okay. Thank you so much for that very clear, deep examination. I'll go and divide when I'm going now. I'll go and divide mine into 4 using my nipple as a focal point. Then I do here, I do there, I do here, I do here, and I raise small because it extends small, and I check. If it feels funny, I have to run. Let's remember, as I introduced earlier, Bob Freeman, opposite the Embassy of Lebanon, Osu, is doing free screening for everybody, male, female, this October. If you haven't gone from 1st October, it is not too late. Kindly go and get your breast screened.
For free.
For free.
Thank you.
Thank you so much, Dr. Eva Vera Tetefield and Nurse Endurance Tete. Thank you so much for coming. I'm also very grateful for joining and being part of this conversation. This conversation has actually encouraged me to regularly screen my breasts, personally and at the clinic or any health center. This has been Covered Conversations. Kindly join us on YouTube at SIC Insurance PLC. As Audre Lorde would say, taking care of yourself is not self-indulgent. It is an act of survival. See you next time. Remember, our promises are sacred.